correspondent, Mayor Robert Hofmann, who, good morning, Mayor, first of all.
Good morning. Thank you for having me.
Our pleasure. So I guess you guys have been asking for the detailed information on the number of COVID positives by village. It was a rapidly evolving situation. Thursday, Friday, you guys had it. This info hit the island over the weekend. I guess we'll just start there. Can you kind of unpack for us what some of your constituents were saying and maybe what some of your colleagues were saying about people now having a better idea about COVID positives at the village level?
Sure. Well, on Wednesday we started getting the information in saying that they're going to start releasing the villages on Thursday. So we had to plan around a Thursday video call, and so that happened Thursday morning. And then during that meeting, video call, there was concerns raised by mayors asking for more information that we wanted compiled. They said they're putting it together on a dashboard, and so they were able to kind of compile that, and they released, I guess, what they could to the public on Friday. I guess they said that's without violating anybody's HIPAA's rights or anything. They were to kind of give that to us, and it showed total numbers by villages. It showed the recoveries, and so are we completely satisfied? No. Some of us want more information. That's kind of always going to be that way. But for the rest of us, it's great to sigh of relief. But we did notice on the weekend, as mayors collectively, there was less people out. So that might have been something that we figured that might have contributed to it, considering it was a payday weekend for some. So, but there were just generally less people on the road. So we were pretty happy about that. And we're going to continue to press on and ask for more transparency.
What other information are you guys trying to get, Mayor?
I think they wanted the villages of those that have died. That's one that was not included in that. And then the other was they do the homeless, where they're actually from on that end. So so we can, because there are a lot of homeless out there. But if they're homeless in one particular area, village park, we want that included in that area so that we can also figure out how to minister to them and take care of their needs, what their needs, if they have any, on that end. So that's something that we did ask for, and then we wanted more information on how they got it, whether it be through functions or events or gatherings or whatever else. Some of it's very vague on it, but to have like six or I think they listed 6 or 7, but there was others. There were more flights because it's hard to say that 100 some were community transmitted, but how did they get it? And I think it would have been a better way to kind of list it out, to saying, okay, these 117 may have got it this way, or but I think that'll also help flatten that curve by telling people, hey, it could have been got it at a store, or they got it at a restaurant, or from a delivery driver, or whatever else like that.
And I think it was Dededo Mayor Melissa Savaras who was saying that they wanted more information in terms of what neighborhoods, right, are the positive cases.
Yes, and that's the thing, is that we're for the seniors, for the senior meals, for example, we're maxed out on the number. For Sinajana alone, we have like 126 deliveries that we do that. And I went back and I said, okay, since you can't tell me who they are, here's the list. Why don't you delete the name who's not going to get a meal, and or just say that, hey, they're going to get a meal a different way. So at least we're lessening the potential exposure. He goes, oh, just keep doing what you're doing, though. Take protective measures, and but we're like, yeah, but the whole point of it is, we don't know that, they could be the person could be in the house that is fully isolated and they're following the rules, but their family members have come into contact that way, and they're the ones coming out receiving the food. So there's potential exposure there. And then that one driver, that's not their only destination, so they're going to stop by 10 other houses. They may bring whatever to the next 10 houses. So it's very hard to kind of look at, and they don't see it our way. So we're just we're hoping that people are going to listen on that end. But I knew who the 4 for Sinajana were. I know they did follow the rules, and so I'm kind of very relieved that they've passed and they're now testing negative. But we wanted to see if there's any more, because I only knew of 4, so it's kind of like, okay, so there was only the 4. So
what's this 5?
I'm happy the residents trusted me to do that.
You've had this Zoom briefing, the mayors and public health. That was Thursday, right? And then Wednesday you had a briefing with the governor. The mayors did, correct?
Yes.
Correct. Was there any discussion between either about mass testing?
We did ask for, that's something that we've been raising, asking how we go about it, and they rely a lot heavily on the physicians group and the resources that they're getting, and we get the same. These tests everyone's asking for tests. All the states were competing, so we did bring up the CNMI issue and saying, why don't we just take some of ask for some of that batch from South Korea if they're giving, or other areas, other nations that call Guam a friendly area, and just use it and run the test. Put a positive actual corona into it and see if it tests positive and negative. And there's ways you can try to validate the tests, and any testing is going to be good. So but to rely a lot on the private sector is also very good. Something that I don't know if people want to do that. Get in a car, go out there, get down, sit in the clinic and get swabbed, unless DSL and the other clinics want to do their drive-through testing, and then find.
I don't know, Mayor. It's a public health emergency, so I feel like public health should be doing more. So is that kind of your assessment of how do you? We had this conversation the last hour. How do you digest the constant barrage of zero positives? I mean, do you think it's something that we can really believe in, or do you have questions about the number of tests we're doing, or maybe even the criteria and who they're testing?
I think it's criteria based. My wife and I were talking about it last night. I said maybe if they're only testing 9, maybe it's because those 9 exhibit some form of a symptom for it. And as these people either call the 311 hotline and say this is what I have, and the nurse refers them to get tested or not. But that could be one way. It's just they're not meeting the criteria. But I don't know if I don't think it's based on the availability of tests. But I'd like to give the benefit of the doubt that there's less people out there saying I think I have flu-like symptoms and all the other things that are associated with COVID, and so they're the ones being requested to get tested. But I know that when they test in the morning, the results come out in the evening. So I'm just glad it's coming out at least before 9 p.m. A couple of times it came after 11, and people wake up to the news and they're like, "What? I thought we were okay." And so, I think people want the news and the information while they're still awake.
And how critical you think it is for them to put this information out? I don't know, who is that person in Adelup or the governor's office or whatever with the COVID-19 response? Who's that person that says, hey, wait a second, you think if we put out that we only tested 9 people, maybe people are going to be like, hey, why'd you only test 9 people today? Why'd you only test 7 people yesterday? I wonder who that voice is, and if they're listening to that voice, or if there even is one.
I think they're the ones preparing it. I think it goes up to the lab. It's like I said, it's difficult to navigate to see who's calling the shots and what gets done. So I'm pretty sure it's somebody says how many are tested, then the lab prepares it, does the results, and says here it is, and then go make the press release, and they send it to another person who's not doing any of the stuff. So I think that's kind of where they only prepare what they get, and is there an ability for them to ask questions to say give me more? I don't know.
All right, someone put a comment here. Almost sounds like the test is a cure for COVID.
No.
I think it's a cure for maybe us not knowing where the hell we're at with this thing.
Mm-hmm.
Yeah, but I want more mass testing. I mean, if the federal government is shouldering the cost for the testing or whatever, I think if they're testing or the treatment, one of the two, then maybe the clinic should have the ability, if they can, because if the government only has X amount of tests, how does DSL and the other clinics have tests as well?
Well, we know.
What are they using?
Right, and we heard that they were doing the test, but then we also heard that it took 5 to 7 days, and we haven't seen that. I was assuming that in 5 to 7 days after them announcing that commercial testing open, that we would see, 200 tests taken, this many positives, but that shoe hasn't dropped yet, and I don't know why.
Yeah. And I think the clinics are just being cautious about having either exposure or figuring out a drive-through method.
Yeah, and this is, obviously a lot of people have questions about testing, but they had said Friday, people aren't presenting to us, and maybe they're getting stuck in your roadblock. You're telling people to stay home, but then
So did they?
That might be.
When you asked about mass testing, did they tell you when they plan on rolling it out?
No, they didn't.
There's no timeline.
No timeline on that end. They're just, a lot of it was, how are we doing out there? Do we have enough protective gear as mayors. We're servicing the people. We're continuing to do our things, and so it's we raise things, just general work issues with us. Either our employees and exposure, and then also assistance that if they need. And so we stand ready to assist, but we still haven't gotten that call on that and what else they need us to do.
Well, I understand that what also was discussed was what are we going to do? What are the plans for the homeless population? And Tumuning Mayor Luis Rivera, she was concerned, considering she does have quite amount of people that are homeless in her village, but there has been no plan other than we're still working on it, and Paseo might be a location that the administration is eyeing.
Yes, and that's correct. That's something that it was discussed about the homeless. They're figuring either containers, retrofitted containers to be put there, and then they're looking for the existing infrastructure. Some of the suggestions are why don't they use Tizen, and then airport police is there. It's easier to view, and there's not many tourists coming in, so maybe the airport police can do a little bit more. I don't know what their workload is, but I'm just saying that it could be something they can pull double duty for. But I think Paseo is one of the more desired locations, so I think that's in the works. I know that over the weekend they've been talking about that. I'm not sure who the lead on that is, but I know that is something. And then the other thing we did discuss is how to get disaster, I guess, as people apply for either labor or other types of assistance, is to do these points of distribution. So they're looking at mayor's offices for assistance in terms of copying needed documents which need to be submitted, looking for drop boxes. So that's one of the discussions we had, is how do we do this, remain safe, but at the same time, they can expect 45,000. They expect applications for all these other types of assistance, and so mayors are actively looking at how we can best do this, whether it be a north, central, south approach or it's just all 19, and how do we do it in a manner where you practice social distance. And a lot of these people that are probably going to apply for the assistance don't have the means to travel very far. So I think one of the things we are hoping is maybe all the mayor's offices. Right. So I know labor departments actually. So when you actually talk to Dave, that's something.
He's right on the line, yeah.
Yeah, so that was one of the snippets that we were looking at, is how do we go out and assist labor department in getting those information out, because some of these people would need computers to fill information out,
right,
and assistance. And we offered our facilities as mayors to help do that, to help our constituents.
Well, thank you, Mayor. I got to get Dave on the line because he's got a conference call, and I know there's a lot of people waiting for that PUA F